Dr. Peter Glidden, your steadfast advocate for health, thanks for your time. We need to talk about the Florida shooting again because it is on everybody's mind, and rightly so. Last night I was pleasantly surprised to see on the Tucker Carlson show and the question, are pharmaceutical psych drugs responsible in any way for the generation of the behavior in these people who choose for whatever reason to randomly murder innocent children? Are psych drugs the cause? It was, of course, a question which was posited because we don't know what the cause is. Could be many factors. But I'm here to tell you, after 29 years of clinical experience practicing naturopathic medicine in primary care settings, the chances are high that the pharmaceutical drugs, the psych drugs specifically, that these people were taking, most of these shooters were taking, or had recently stopped taking, have something to do with this. It needs to be investigated. Might have nothing to do with it, but it needs to be investigated. And I was pleasantly surprised to see this idea floated on mainstream television, so kudos to Mr. Carlson and Fox News. You know, those of us in the medical industry have for a long time known about the inherent bias in pharmaceutical research. And look, let me just state for the record right from the top, I'm a licensed naturopathic doctor, but even as a licensed naturopathic doctor, I can prescribe drugs. Did you know that? It's not the drug, it's how it's used. It's not the gun, it's how it's used. This is not a vindictive against pharmaceuticals. This is an investigation into the effects of psychiatric meds on behavior. We already know that antidepressants will generate suicidal behavior. There's a black box warning on many antidepressants can cause suicidal ideation. We already know that. It needs to be investigated here because it's a possibility that these psych drugs had a lot, if not everything, to do with helping these people to go off of the deep end. And we've known in the medical industry that the pharmaceutical industry is not the most upfront, honest business in the world. Washington Post: as drug industry's influence over research grows, so does the potential for bias. Newsweek: Big Pharma plays hide the ball with data. The Guardian: drug firms hiding negative research are unfit to experiment on people. You know how it goes. It's good to be the king. So here's what happens. A pharmaceutical company rolls out a new drug. And I'm making the numbers up here, but just for educational purposes, let's say they do 100 research studies on this one drug, and 75 show negative outcomes and 25 show positive outcomes. They hide the negative outcome studies and they publish the positive outcome studies, and the doctors in the field trying to help people have no idea. So the doctors prescribe the drugs thinking that there's only positive outcomes. They're not aware of the negative outcomes. People are hurt. People are killed. And then the pharmaceutical industry, too big to fail, their wrist gets slapped, a little fine here, a little fine there. The behavior persists. And this is the problem. We need to know now, once and for all, conclusively, scientifically, whether or not these psych drugs are able to generate this type of insane behavior. So here's the fix. You heard it here today, February the 16th, 2018. Number one, I bet you'd never think you'd hear these words coming from my lips. You give the pharmaceutical companies immunity from prosecution, starting at this moment in time, moving backwards. Because we need to secure data from them. We need to secure the research from them. And if they know that the research that they're hiding is going to implicate them and make them liable, can you imagine the class action lawsuits that would rise up because of this? So the only way that we're going to be able to get truthful idea from the pharmaceutical kingpins, in my opinion, is to give them a pass. Number two, send in FBI agents to collect all of the research that was published, research that was shelved. Number 3, have an independent committee without any political connections review the research and make recommendations. Number 4, hire me to head the committee. That's right, ladies and gentlemen, yours truly, Dr. Peter Glidden. Why? Because, like President Trump, I am an outsider to mainstream medicine. That's why President Trump is so effective. Whether you love Trump or hate Trump, you cannot argue that he has been extremely effective, and he has had a gigantic impact on the political arena in the last 13 months. Why? Mainly because he's not a political insider. He's a business outsider. I've had 29 years of clinical experience as a practicing naturopathic medicine in primary care settings. I've been around the block, and I exist outside of the mainstream of conventional medicine. I have a great deal of perspective to bring to bear here, and I'm not going to be hoodwinked or sidelined or cozied up to by the pharmaceutical industry. Then, most importantly, we need to have Congress pass a law and have the president sign it into action, which makes the hiding of negative outcome medical research illegal. You have to publish all of your findings, not just the good stuff, and there have to be huge fines, and I mean huge, crippling fines levied against companies which hide the research from this moment in time moving forward, with mandatory jail time. This is one of the big problems with the pharmaceutical industry right now. They get away with murder and they get a slap on the wrist. Nobody goes to jail. There's not even an OSHA ticket. For goodness sakes, this needs to stop, and this is how it should happen, in my humble opinion. Dr. Peter Glidden, your steadfast advocate for health. Follow me wherever you can, because in point of fact, your life and the life of your loved ones may depend upon it. God willing and the creek don't rise. I'll see you next time. Thanks for your continued support.